Good afternoon.
Good afternoon, ma'am.
Now I'm going to share my first presentation. Can you see my screen?
Yes, ma'am, we can see your screen.
Okay. So in today's session, we are going to see regarding the risk assessment. In addition to the risk assessment, I have planned to do another one kind of assessment, which is the nursing assessment. The assessment that we are specially focusing on the nursing pathway, nursing career, because assessment we can do, as I already told you, we can do in every workplace. It can be a health and social care sector, and apart from health and social care sector also, we are following an assessment process. Why? Because assessment simply means we are gathering a data for the progression of any activity. But when we are talking about the health and social care, the assessment that are carried out by the nurses, the management that are used by the nurses are very, very accurate one, because those assessment, they are mainly focusing on the patient side. The care that they are provided to the patients, they are recording. So that's why we are considering that when compared to other healthcare professionals like physicians, physiotherapists, radiotherapists, these nurses management is very much important. So before moving to the nurses assessment, today we are going to see about first the risk assessment regarding the risk, because in health and social care as a professionals, we are having so much of risk and hazard in every day-to-day routine work. We are encountering so much of hazardous things as well as the risky items. So before in order to solve all those things, you need to know about the risk assessment. These are the learning objectives. You need to, after the session, you can able to define the term risk, hazard, and the risk assessment. And you can identify the different types of risk in health and social care and the different types of hazards in health and social care sector. And you can know why this risk assessment is this much important and what are the types of risk assessment are available, and the risk assessment process you can explain, and also how we can control the risk in the health and social care sector. So risk. In previous lectures, we have studied regarding this risk, but in that we studied about the risk management. So if you encounter any risk, how you will manage that risk is studied. But here we are going to study before managing, you need to assess why this risk happens, what are the causes, and how you can prevent if it occurs in the future part. So all those all the things you need to have some data. For that we are studying the risk assessment. Risk means it is a chance or high, the chance, it could be low chance or high chance that one can get harmed by a hazard. So risk means we are simply telling that a person having a probability or there could be a chance of getting harm by any object. It can be a chemicals or it can be any microorganism or the living human or animals. So a person can get harmed or injured by any of things. But we can't tell 100% there is a chances of getting damage, but it's a kind of probability. So we can't tell accurately or we can't tell confidently that this person will get harm or injured by this object, but we can tell, okay, there is a chance or the probability, that is risk. The likelihood that a specified undesired event will occur due to realization of a hazard by or during work activities or by the products and services created by activity. So risk means that. So when you are telling that, okay, this patient is at risk for cholesterol means, so the person is very much at a last stage of getting high level of cholesterol, but we can't tell that definitely he will get affected by the high cholesterol level. Once he followed all the changes and all the proper management, in future his cholesterol level could be decreased. Now he is at risk. That means there is a chances of getting injured or getting harmed by the high cholesterol level. That is risk. So when we talk about the risk in a health and social care setting, so these are some of the risk. In the previous session also we studied what are the types of risk. So commonly in health and social care sectors, we are having technological skills could be occurs. Technological risk means the reports, the laboratory investigations. Those are the technological risk. One example is a laboratory investigation. Sometimes if the laboratory technologist made some mistakes in the interpretation, can affect the patient's treatment. So it is one of the technological risk. Other than that, the equipments that we are using, like X-ray machines, if the X-ray machine is not working properly, or the radiations that they are using in the X-ray, if it is not if it is not inadequate or if it is beyond the normal range, then in the X-ray means that we are sending the X-rays into the patient body to for the investigation purpose. So those X-rays can cause harm to the patient's internal body once the level could increase. So without checking, or if the X-ray machine is not working properly with the proper voltage or something, then it also going to cause risk to the patient body, and not only to the patients as well as the people like physicians surrounding that. So it is another kind of technological risk. So those things we can tell it as a technological risk. Facility and safety risk, yes, these things also normally the patients they are encountering. If the patient is if the flow of the ward is not cleaned, or if more amount of water is splash out throughout the uh, floor of the washroom or floor of the wards, and if the patient is walking without noticing, or if the healthcare providers are not informing that, then there is a high chances of slip down of the patients. And another thing is, if the patient is a very vigorous patient, is very he is or the patient is very vigorous patient, we can't control the patient behavior in that manner. If we are not providing the side rails to the bed, then there is a higher chances of fell down from the bed. Or if the patient is having fits, so fits to the fits people, we need to cover the patient's bed by the side rails. And as a healthcare providers, if you are not putting up the side rails properly, then the patient will get fell down from the bed. So it is regarding the safety risk. And the facility risk means also same. So these facilities you are not providing properly to the patient. Operational risk means operational risk, the activities. Wait a minute. Operational risk means also the activities or the actions that we are going to do to the patients. Like when taking a blood sample, we need to be care with the patients. So if the before taking the blood, we need to ask some questions, whether the patient veins are properly seeing, or whether if there is any sometimes for the dialysis purpose, there is for the kidney failure patients, they are doing a management called dialysis. In the dialysis means normally we are not recommending the nurses are not recommended to take the blood sample if the patient is having a hemodialysis. To that particular arm, we are not taking the blood sample. And also some drugs like aspirin, it is one kind of medication which can cause us the blood to become very thin. That means if you are on a aspirin for a longer period of time, your clotting means once you get injured, if it starts to bleed and also you are on aspirin, then the bleeding won't stop normally when compared to the other people. It will take some more time to stop. That's why we are calling it as a blood thinning agent. It increases the bleeding. So in those situations, before taking the blood sample, as a good healthcare provider, she or he needs to be asked and she or he needs to be checked whether the patient is having those kind of activities, whether they are having aspirin or whether they are on the hemodialysis, because those activities, if they are not having proper data or the proper information, then it can going to harm the patient. So it is a kind of operational risk. And this operational risk could be happens to the healthcare professionals as well. Occupational health risk means normally the occupational health risk coming there are we are telling to the healthcare providers, the physicians or the nurses, when they are doing any procedures, they are also having a chances of getting harmed by the manipulations. For example, for the cancer patients, we are giving a specialized tablets or the medications called hemo drugs. Those hemo drugs you can't handle by your bare hands. Why? Because they are very mutant. That means they can cause even some cancerous effects to the non-cancerous patient's body as well. So as a healthcare providers, if she is going to provide that chemotherapy drugs to the patient, they should wear the glove and they should wear the mask. So those criteria are present. Why? They are putting, if they are not following any of the things, then they will get damage to their body. So it is a kind of occupational health risk. Financial risk, yes, it is common when we are talking about the patients. Not all the patients are coming from the same economical background. So most of the patients are admitted to the hospital side. They are very, very poor. So if we demand to pay them a large amount of money for the treatment purpose, yes, they are actually at the financial risk. Why? Because if they are not afford to pay that much of money, then they can't get a proper treatment. Then the body become then they starts to develop all the disease condition without a proper management. And communication risk means the way that you are communicating with the patient, the both verbal and the non-verbal communications. So how you are using your words to the patients, whether the words that you are using hurting the patient psychologically or emotionally. So it is a communication risk. And security risk means if there is any whether the patient is having any sexual abuse or physical abuse when during the time of the hospitalization, and even the healthcare providers, nurses or doctors, whether they are experiencing any psychological or the sexual or the physical abuse by the co-workers or by the patients, so those will comes under the security risk. So these are the commonest risks that we can encounter in the health and social care sector. This is regarding the risk. Then we are going to see another new word like hazard. Hazard means actually it is causing harm or injury to a one individual. They are 100% causing harm or individual. So there is no any probability. We can't tell, okay, in future there could be a chance. There are no chance. We are not using the word chance, probability. Hazard means anything it is going to cause harm or injury to an individual. So thus what are the hazards it can cause harm or injury means like chemicals, electricity, working from a height or machinery. So hazard means these are the commonest things that the people who are working in a health and social care sector, they may encounter injury or harms by these particles or by these things. A source or a situation with a potential form harm in terms of human injury or ill health, and also in addition to causing harm to the patient health, it is also damaging the property, damaging the environment, and combination of all those things. So hazard means it can cause only damage to the patient body, or it can only damage the property of an individual, or it can damage only the environment, or the combination of all the things also could be happens. So if the damage caused to the environment, eventually it is going to cause the damage to the property and the individual health. For example, bomb blast. Bomb blast is one of the hazard. Why? If bomb blast happens in one particular area, then it going to damage the properties present in that area. The environment get damaged, and the peoples who are involved in the particular institution or in that particular organization also going to have a bad health, and sometimes the people may died due to the bomb blast. So it is a hazard. Another example, tsunami. Tsunami is one of the hazardous events. They are natural hazards. One of the natural hazards occurred. So during the tsunami environment get polluted due to the spilling of oils from the ship. So and all the sea that fish and all the other sea creatures, they got affected, and the environment got polluted, and once it enters into the city, it damaged all the properties, all the houses of the people, and also eventually it causes so many communicable diseases, cholera and other disease conditions. The people get affected, and through this unacceptable tsunami and the loss of their loved ones, some people psychologically affected, emotionally affected. So these things collaboratively we are calling it as a hazard. Hazard at work may include noisy machinery, a moving lift, chemicals, electricity, working at heights, a repetitive job, or inappropriate behavior. So these are some of the hazards which we can tell in any kind of workplace, not only health and social care sector. When you take any kind of workplace, the hazards could be present. But talking about the health and social care, the most hazards are mainly focusing on these chemicals, the drugs and chemical substances, elements that we are using, and the electricity, the technological hazards. The electricity is important for the manipulation or the activation of some technological machineries. So that machineries will be happens. So this is we are calling it as a hazard. Now we'll see what are the types of hazard specially present in the health and social care setting. So the hazards that are present in the health and social care settings, we are mainly telling them as a occupational hazard. Or occupational hazard, that term occupational hazard could be applicable to any kind of workplace as well. So social hospital setup, other social workers, or other than health and social care, other workplaces. So the occupational means the hazards that we can encounter in any kind of occupation is occupation hazards. So there are 5 types of occupation hazards. They are physical hazard, biological hazard, chemical hazards, ergonomical hazards, and the psychological hazards. So physical hazards, they are mainly involving the noises from the machineries, vibrations, radiations, lightning, heat, cold, fibers, dust. So these are coming under the physical hazards. For example, if you take a person is working in an asbestos company. So this asbestos, where during the prolonged period of working with the inspiration or with the inhalation of that asbestos, the asbestos, they are very, very small particles. They enters into the patient, the person's lungs and get deposit. With the accumulation of that asbestos, eventually the person may develop pneumonia or a lung, the pneumonia could be occurs, or the lung failure also could be occurs. So it is a hazard, definitely. So this has the inhalation of that asbestos particles. In future, the person is not at risk. It definitely it caused the damage to the patient body. So that is we are calling it as a hazard. These are some of the example for the physical hazards. When we see the biological hazards like microorganisms like bacteria, fungus, insects, viruses, these are biological hazards. Wait. Chemical hazards means any kind of chemicals that we are using, or the liquids, vapors, fumes, the mist that we are, or some gases like nitrous oxide, sulfur dioxide, the chemicals that, or the smoke that are coming from the industries, the industrial smokes, they are contain lot and lot of hazardous chemicals, or the water that is coming out from the large industries, those water that mixing with the rivers or the lakes, that also containing the waste liquids or the waste materials. It can be the liquid form or it can be in the gaseous forms. They are also, we are telling it as chemicals. In addition to this, when we are talking about the hospital setups, the medications, the drugs that we are using, as I already told you, the chemotherapy drugs, it can be available in a tablet form, or it is available in a liquid form. So the handling, if there is no proper handling, yes, it is going to cause damage to the patient body. So it is chemical hazards. Ergonomical hazards means it is the working environments, like if we are going to handle in a manual way, For example, some activities we need to do it with the machineries. So if there is no any machines and you are going to do the activities continuously in a manual way by a human manpower, then it is going to cause some hazards to a particular individual. Repetitive movements, the movements that are undertaken by a person, restrictive working area, those are ergonomical hazards. Psychological hazards means, yes, obviously, like stress, depression, and cornering by the co-workers in a working environment, feeling alone, and the workload. So those are the psychological hazards. These all the activities or all the elements made the person or an individual, their life should at one time they are having they are developing an issues. So there is no any chances or probability. Definitely, if they expose to these hazards or these things for the prolonged period of time, it is going to harm or injure their physical, social, spiritual, emotional. The whole body will get affected. The commonest type of occupation hazards that are prevailed in any kind of workplace. This is a hazard awareness chart. So in this chart also you can identify it. So health hazard, fire hazard. That means classification, we can classify it like some health hazards. We can, what are the health hazards are present, and fire hazards, reactivity. Reactivity means especially the reactions with the chemical that we are telling it as a reactivity hazards. And here that so they are putting from 0 to 4. 0 means minimal hazards. Minimal hazard means there could be no any hazard present. 1 slight, 2 moderate, 3 serious, and 4 is the most severe hazard. And here also you can identify the symbols. In some places, in some working environment, you can identify like these symbols. So if it in this will indicating flame. Flame means the particular if the particular area is flammable. So if you are going to use or if you are ignite the flame, then there is a chances of getting that building or that part burn quickly. So it is that means flame, and it is indicating explosive. So explosive items are present in that area. So if once you encounter this symbol in any storeroom or anything, that means when you are entering, you need to be very cautious that you can't take any explosive materials. Otherwise, it will get explode quickly. That is explosive. Then severe toxic. In some medications, they are marking or they are having it is indicating they are severe toxic. Severe toxic means when you are handling, you need to be have proper precautions. Otherwise, even the inhaling or even the small touching of that chemical can cause the toxic to your body. And here corrosive. Corrosive means so when you are keeping these particles for a longer period of time inside the air, air inside the water, it will start to get rust. Rusting, we are telling it as a corrosive. So corrosive also not good. And gas cylinder like fire extinguisher. So this is the symbol that we are using for the fire extinguisher. And here it is for the health hazard. So they are having some healthy hazards particle. That means in some food packets or some food packets, they are having some small sachets inside this. On the sachet packet, they may have some kind of this symbol. It is indicating it is not consumable. That is, it is inappropriate to consume. Once you consume that small sachet packet, it is going to make a hazards on your health. So these are some of the symbols that you can encounter when you are working in any kind of working place. And this is, we are telling it as a PPE. PPE means personal protective equipments. So there are personal protective equipments are there. Once you are going to work as a overseas healthcare providers or in a health social care settings, you need to be know what are the personal protective equipments are available. So one thing that we all are known after this corona period, mask. We are wearing mask. Mask is one personal protective equipment. So it is going to prevent the dust particles or the microorganisms that are enters into our body through the inhalation and through the so mask is one of the personal protective equipment. Other one is the goggles. Goggles means it's a kind of spectacles. So but we are not telling it as a spectacles or specs or sunglasses. The specific term that we are using is a goggles. Goggles commonly used by the people who are working in a laboratory especially. Apart from that, in a normal routine board setup also, if there is a higher chances of transmitting of any microorganism or diseases, higher chances of communicable diseases, then we can wear the goggles in that. But these kind of goggles normally wear by the people who are working in the laboratories. Because when during the laboratory checking, there is a chances of spill out of or splash out of chemicals or any other particles that the samples that may enters into the eyes. So for the protection of the eyes, we are wearing the safety goggles. Then another thing, you can wear gloves. So for the protection of the hands to prevent the transmission of any hazardous things by touching, we are wearing the gloves. Gloves for the hands we are wearing. So under the gloves also there are disposable gloves and the sterile gloves. There are different types are present, but normally for the protection of the hand, we are wearing the glove. And face shield. So this face shield also we are familiar after the corona period. Face shield will helps to cover the whole face, the eyes, nose, mouth, and the whole face could be protected from the environment by wearing the face shield. Apron, normally this apron we are using for the especially during the surgery time, the physicians and the nurses, they are using this apron in order to prevent their body and their clothes from the patient's body fluids. Like sometimes during the surgery time, blood will comes out, more amount of bleeding, so that blood will get stain in on their body, the person who is doing the surgery. So to prevent that staining, they are wearing the apron. And when we are talking about the routine ward setup, when a nursing officer is going to provide care to the patients, like wound, to clean the wound. So when they are cleaning the wound, there is a chances of getting the pus or any other discharges can stain in the nursing officer's dress. So to prevent that, we are wearing the apron. So apron, it is going to cover the whole body, not the between the head and the legs. The in between the part of the body could be covered by the help of the apron. And other than that, boots also normally we are by the during the surgery time we are wearing the boots. Boots will helps to prevent the lower part, legs and the feet from the transmission. And other than this is the full protection suit. So normally those went for the PCR test, you can identify that the people who are coming for taking the sample from you, they mostly wear this full protection kit. So this full protection kit helps them to protect their whole body. So these are the personal protection equipments that we are normally using in the health and social care settings. In addition to this, we are having a cap, a surgical cap. So during the surgery, we are using that surgical cap. And but in the normal routine setup also, if there is a chances of like corona or any other highly transmittable diseases, we are wearing a cap. That cap we can cover our all hair and head. To protect the head and hair, we are wearing the cap. So these are the personal protective equipment which helpful to prevent from our body and the health from the hazardous particles. This is about risk and hazard. Are you all clear up to now, or do you have any doubts?
Clear, ma'am.
Okay,
Clear.
thank you. Now we'll move on to the risk assessment. So far we studied about what is risk and what is hazard, and now you have some idea regarding the difference between risk and hazard. So, or this risk could be happens due to the hazard. Once the hazard occurs, then we can tell, okay, the patient may have some risk to getting these to develop. But for the risk assessment means for the risk management, to control the risk, to control the occurring of the risk, or once the risk occurred, to prevent that, we need to manage that risk. But before managing the risk, we need to get some data. Why this risk, what is the risk and why it happens to the person, what are the causes, how can we manage. For all the things, we need to collect the data. That is, we are calling it as a risk assessment. A careful examination of what in your work could cause harm to people, so that you can weigh up whether you have taken sufficient precautions or should do more to prevent harm. So that is risk assessment. Workers and others have a right to be protected from harm caused by a failure to take reasonable control measures. Yes, it is our right. So all the workers and the patients, both the healthcare providers and the healthcare recipients, they are having a right to be protected from the harm that are caused by the inappropriate activity or the inappropriate works handled by a person. It is a way of determining risk and dangers in workplace. Yes, with the help of the risk assessment, we can determine how much or how extent the risks are present, or how extent the working environment is risky. Why? With once we gather this information, then we can use it in a future period as well. If in the future, if any risky activities happens, then we could be preparable for our early preparation, preparation. So this risk assessment is important. It is another one of the importance in the risk assessment. Risk assessment includes analyzing the possible hazard that could occur within a work safe manner. So normally assessment means we are gathering the information to identify the solution for a problem. It is a best criteria or the best thing that we can use in a critical problem solving procedure. So here risk assessment also, with the help of the risk assessment, we can analyze what are the possible hazards are present and how they occurs, and with all these things we can come to one solutions to prevent for the occurring, or after the hazard occurs, then we can minimize the damage or the injury caused by that hazard with the help of this risk assessment. The risk assessment helps to avoid injury to an individuals, and also it can help to avoid the damage to the property as well as the environment as well. If the hazard cannot be avoided in a safe way, then the risk assessment will say that the activity shouldn't be carried out. Yes. So sometimes some hazards cannot be avoided in a safe way. So in that manner, the activities that we are telling by the risk assessment, we can't do if the hazard is not removed, then we can't use the assessment that we collected so far to carry out the activity. Again, we need to analyze why we can't, or why we are not able to remove this hazard, or why we are not able to avoid. Then again and again we need to carry out the assessment in a deep and systematic way, and we need to find out a new solution. So that the proposing new solution should be implement to the hazardous activities which we encounter that they couldn't be avoided. In that situation, we need to have a deep and detailed assessment process. So that is about the risk assessment. Then why this risk assessment is important? First one, yes, obviously we can assess if there is any dangers are present in a surrounding environment where the people they are present, and it is the one. And the second one is, so the risk assessment are needed so that the risk of danger happening within the lab or any other workplace is reduced and eliminated. Yes, for the reduction or the minimization of the danger, or to eliminate them, we need to have the risk assessment before it occurring. And also it helps to protect the people, especially who are working in the laboratory, and not only the person carrying out the practicals, but also others around. So when we are talking about the laboratory setups with the risk assessment, the risk, the not only the who are carrying the practicals or the demonstrations, they are not only at a risky state. The people who are accompanied him or her also at some risk. For example, when a scientist, like a laboratory technologist, not the scientist, a laboratory technologist, he is checking a sample of a person to check whether the person is a corona positive or not. So the person who is on the practical is not only at a risky state, because the corona, we all know, it is a highly transmissible disease. Even with the air, with the inhalation, it can spread quickly. So now, if all the people who are present in the particular area, if they are not following a proper precautionary methods, then there is a chances of spreading those microorganisms to all the people who are accompanying, because laboratory means it is not a very spacious area, and also it is not a open area. It is always confined and closed small area. So normally in some movies, in English, in Hollywood movies, you can see that small microorganisms, it becomes a large virus, and those viruses transmitted to all over the body very quickly, means because the laboratory area is very confined. That means a compact area, very small, and there is no any windows or like that. So in that manner, the person who is going to have a practical, or the person who is going to investigate a sample, in addition to him, the people who are working with him also having a higher risky chance. So in that manner, we need to assess. That assessment means we need to check, okay, whether all the people are wearing all the protective equipments, and whether they are following all the guidelines and the principles in a proper manner. So if there is anyone not wear the PPE, so likewise we need to check. And also it helps to set out the guidelines to an individual should and shouldn't do with the lab or work environment. And also, yes, with the risk assessment. So once we do the risk assessment, we will gather more and more information. So in the assessment part, we can gain more new information as well. With that new information, we can propose a guidelines or the principles, that what a person needs to do and what he or she shouldn't do in order to prevent from them from a hazardous activity. So for these only we are having this risk assessment. These are the importance or the purpose of doing the risk assessment in the health and social care sector. So are you all clear up to now, or do you have any question?
Clear, ma'am.
Okay, thank you. Now we'll move on to the types. There are two types of risk assessment. One is qualitative risk assessment. Other one is quantitative risk assessment. Qualitative risk assessment, it is the most commonly one when we are talking about assessment. This type of risk assessment we are commonly using for gathering the information about the risk. So here in the qualitative risk assessment, the person who is doing assessment, we are treating them as assessor. So the word assessor assessment, you are familiar. So the assessor use their personal judgment to identify the hazards around the work, assess the risk and plan control measures. So in the qualitative risk assessment means it is a judgment or it is a thoughts and opinions of an assessor. So an assessor, he is looking at environment and throughout the environment he is judging. Okay, so here the needs they didn't recap properly, and the patient is very vigorous and he is very anxious, but the side rails are not present on both side of the bed, so there is a high chances of patient get fell down, or and also the patient is having periodical fits, and if there is no, but the patient is put on the bed without side rails, and there are no any bystanders as well. So at any time, the patient with the fits, the patient can develop the fits, and there is a high chances of fell down from the bed and got injured. So those things, those judgments and the opinions are made by a person who is getting assessment from the patient. So those are undertaken by the assessors, and then with that they are assess the risk and maintaining the control measures only by the observation of the assessor, and according to that he is marking whether the risk is high risk level, low risk level or moderate risk level. So qualitative risk assessment means with the observation of the assessor they are formulating the level of the risk and they are making a plan. But the quantitative risk assessment means here we are having the assessment tools. We studied about different assessment tools, techniques and instruments. So for the risk also, in the quantitative method, they are having some risk assessment tools, instruments or techniques. So with that tools and techniques only, they are telling, okay, the person is having high, low or moderate level of risk, or how the risky and how the environment is risky. So the most commonest assessment tool that we are using to measure the risk is risk matrix. Here, this is the risk assessment matrix. It maintains the probability as well as the severity. Severity means how severe the risk occurs. Probability means chances. How about the chance? For example, uh, here frequent form means there is a higher chances of getting the damage by the risk. So if the patient is at risk, then there is a higher chances of getting damage, that damage causing the person, the damage can, or the person is going to get the harm or injury at the most severe level due to the risk. So that is here. So with the probability we can check what about the patient condition, whether it is negligible means whether we can neglect the risk. That means the risk is very minimal. It is not going to cause any adverse actions to the patient body. But whether it is very severe or not, we can assess it. Here we are not looking on, we are not only gathering the informations by looking the patient environment or by looking the person's status. We are having some kind of calibrated scale. With the scale only, we are confirming about the risky activity. So this is, we are calling it as a quantitative risk assessment. So here you can have the difference between qualitative risk analysis or assessment and the quantitative risk analysis. So you can go through here. So the basic idea is qualitative means through the observations, they are gathering the information and formulating the plan. And the quantitative means with the calibrated to specify, or with the calibrated or designed specified tools, instruments or the measuring techniques, they are identifying or they are telling about the risk assessment. Example, the risk matrix. So this is regarding the types of risk assessment. Then we'll move on to the risk assessment process. So in the risk assessment process also there are 5 steps are present. So in this order only we are going to assess the risk. First we need to identify the hazard. So what is the hazard? Whether it is a physiological hazard or psychological hazard, or what are the types of hazard we need to identify. Then we need to decide who must be harmed. So with this hazard, who can get the harm and how they are getting that harm to the body or whatever. The health, whether who are getting the harm and how they are going to get injured by that hazard. Evaluate the risk and decide on precautions. Then you need to analyze the risk. You need to evaluate the risk and decide what are the precautions. So already if the precautions are made, still the person is getting damaged by the hazard, then why? So what are the, where we have made the mistake? Or what are the precautions we need to improve? So those things by evaluating we can identify. And finally, if you find out any new, then you need to record it, and once you record it, then you need to impose it to the action. And review the assessment and update. Then the assessment should be reviewed once in a month or twice a month. It depends according to the protocol. So you need to review and you need to update it. Sometimes within the 1 month of period, the risk, the activities, the activities or the actions that you have taken to minimize the risk, it is not enough, because the risk that causes now when compared to the previous one is very high. So you need to assess again and you need to gather the data and you should update those things. So it is a process of risk assessment. Now we'll see one by one. So step 1, identifying the hazard. Yes, first you need to know what can be classified as hazard. So if the electricity, chemicals, or whatever present in a particular environment, first you need to identify which will comes under the hazardous materials. Like, so we already studied regarding what are the types of hazard. So in that you can pick out. So what are the hazardous material present in that particular environment. And also you need to think about the long-term hazards, whether the hazard they are long-term or short-term. Sometimes chemicals, they are long-term hazardous chemicals are there. Electricity means it could be a short-term, but normally these medications and the microorganisms, biological hazards are very long-term. And you need to check it out, whether they are long-term availability or short-term available. For example, look around for, so in a particular hazardous environment, you need to check if there is any hazardous chemicals are present which are causing damage to the human body, or if there is any chemicals get when a patient's body accidentally or intentionally. So it is, we are telling it as identifying the hazard. It is the first step. Once you identify, then you need to decide with that hazard who will get harmed or injured and how this hazard going to harm them. So think about the possible health risk or injury that could be caused to one individual. And also you, in addition to this, you can consider is there any activities or any special environment could be needed. Consider any workers may have any special health and work environment. And also consider how the activities undertaken could affect the community or aspect. So for example, when you here consider any workers may have any special health and work environment. So for example, think about the hemo drugs preparation. Normally the chemotherapy drugs are prepared. The drugs are prepared by the pharmacist. So chemotherapy drugs also, there are some specialized people who are pharmacists who are going to prepare. So in the drugs prepare, the tablets preparing environment, you should be checked. People are having adequate amount of PPE and whether the equipments are working properly, electricity is properly or not. How about the waste disposal? So all we needs to be checked. So this is decide because with the chemical substance, chemotherapy drugs, the people who are involving in the preparation, they will get harm. They are going to get harm or injured. And how they are going to get harm? In any way. If the drug splash into the eyes, then it can get into the body and causing the damage. And through the inhalation, by breathing, it can get into the body. And with the mouth, sometimes it can, with the splashing or spilling of the this one medications, it can get into the body. And by touching in the normal skin, it is going to hurt the patient. So this is the way that we are checking how the hazard is harming the patient and how they are going to harm. Then step 3, evaluate the risk and decide on the precautions. Okay, now we are going to evaluating. After spotting the hazard and decide on the actions that would need to be taken. Okay, so first we identified, so the hazard is a chemical hazard. So we identify that, then we need to evaluate that how we can minimize the chemical hazard. So what are the precautions that we can take in order to minimize the patient getting harm from that hazardous activity? When this has to be done, need to do anything reasonable practical that would eliminate the risk of the hazard occurring. If there is no way of eliminating the hazard happening, then the precaution would need to be taken to control the risk to the best ability. Yes, first we need to prepare or we need to undertake all the actions to completely eliminate the hazard. But in sometimes we can't completely eliminate the hazard. In those situations, we need to formulate the measures to control the risk. So with the controlling, we can minimize or we can reduce the damage caused to the person health to some great extent. So first you need to identify the solutions for eliminating. If there is no elimination, then you can have some controlling risky measures. So this is the third step. Step 4, you need to record all the findings. That means documentation and the implementations. In one word, we can tell it as documentation and implementation. So after you formulate opinions and the solution, you need to record all the results of the risk assessment and it should be informed to all the staff. Yes. So after the risk assessment, if you find out any new active actions to eliminate the hazard, or if you find out any new, if you formulate any new principles or guidelines, they should be documented in a written form, and all the written forms should be informed to the workers and the staff who are working in a particular environment. So after all the analyzing and having a written document is not enough. Once you got a written document, you need to be implemented. So with the implementation, before the implementation, you need to make sure that all the staff working in that area are aware about the new guideline. Otherwise, they starts to follow the old methods. Okay, it's also going to cause harm in another way. So it should be needs to be informed. When making a written document of the risk assessment results, it needs to be kept simple and understandable. Yes. So when you are writing a risk results, the documentation should be very, very simple and understandable. Each and every member of the institution should be understand. We talk about the ward setup. In the ward setup, doctors are there, nurses are there, and other health assistants, they are working. So when you use the medical terms for the documentation purpose, the healthcare providers, they can understand, but think about the other health assistants and the health supporting staffs, they are not that much aware about those terms. So if you are going to keep the records, it should be simple and understand who can really, they can easily, it should be in an understandable manner. A risk assessment do not need to be perfect, but it needs to show that an inspection being carried out correctly and that precautions are reasonable, leaving the risk to a minimum. Yes. So the risk, when you are writing a document, it should not be perfect, but the things when you're writing, all the important points should be included. So the unwanted verses or the unwanted words, by using that unwanted words and verses when you're writing a perfect documentation is not necessary. Whatever you're writing, your documentation should mean the content of the documentation should be contains the all the major things that needed by the staffs to be followed. So all the verses and the words that you are using should be hit each and every staff in order to perform their activities effectively. Then only we can consider it, the record is a very, very accurate record. So, and by reading it, the documentation, the risk that happens in future or after it happens, it we can minimize. So once they understand the major points or the major content only, the people, the staff, they can act accordingly to minimize the a particular hazards caused other hazards caused by the chemicals or whatever the things. But apart from them, with using all the technical terms and all the abbreviations or all those things, and when you are going to write the perfect one, and there is no point of using the documentation if it is not in an understandable manner. So this is important when you are having a documentation. And once you document it, you need to be implemented immediately. So only the documentation is not used. So once you document it, you need to be you need to use that into the practice. Once you start to use into the practice only, we can identify that whether there are some more needs to be identified. That means in the review risk assessment. So for one hazardous activity, you formulated a new guideline. So after you practice only, you can encounter whether the practice of that guideline is good or bad, whether we can reduce the risk into a minimum or whether the risky activity getting worsened or not, or the use of that risky activities not enough for reducing the risk. So all those things will be encounter or you can identify once you implement whatever the guidelines or actions you are documenting. So after that, then make sure the risk assessment is correct and that all the hazards have been covered and included, and make sure that people are safe to work. Yes, and in the review risk assessment, you need to make sure whether the environment is safe. And if the hazard occurs after the risk assessment, then changes will need to be made to that risk assessment. Yes, it is. That's why I told you. So once after the risk assessment, you are formulating all the actions. But if once after the risk assessment, the hazard is occurred or the occurring of the hazard is very, very severe, then the solutions or the assessment that you have taken previously is not enough to minimize the hazardous activity. In that manner, again, you are going to do the assessment and you are going to do the assessment in a detail, in a deep manner, and you need to carry all the solutions, and then you are formulating a new guidelines or principle. In that manner, the previous risk assessment should be changed. You can't use the same risk assessment and the procedure. So according to the hazardous event and according to the risky conditions, the assessment and the solutions also need to be changed. That's why the risk assessment is one of the dynamic one. It is not the stable, it is dynamic, changing according to the situations. And it should be carried out yearly to minimize the risk. Yes, it is better when you review the assessment of your risk yearly, then you can have minimize the risk, or it depends on the situation, or if the hazardous event occurs within shorter period of time, then the reviewing also important. Within 6 months or 2 months you can carry it out, or if it is in a normal setup, then yearly risk assessment is okay to have that kind of risk assessment. So these are the 5 steps. So first you need to identify the hazards of what are, then you need to identify who are the people will get how they are going to then you need to evaluate why this happens, and you need to analyze it. What are the problems, and you need to develop the solution, and then all the solutions, all the things you need to document and implement those documented principles or guidelines. And after that, you need to review the risk assessment periodically. So these are the 5 major steps present in the risk assessment process. Are you all clear up to now? Or do you need any clarification?
Clear, miss.
Okay, thank you. Now we'll see how we can control the risk. So under the risk controlling, there are 4 parts are present. Avoiding the risk, retaining the risk, transferring the risk, and reducing the risk. So we'll see what each and every one. So first, risk avoidance, avoiding the risk. This strategy involves a conscious decision on the part of organization to avoid completely a particular risk by discontinuing the operation producing the risk. Yes. So risk avoidance means simply, so what activity or what actions made the origination of the hazard, we are stopping that action completely. Once we stop that action completely, then there is a no occurrence of or no emergence of the risk. So it is risk avoidance. Example, replacing the hazardous chemical by one with less or no risk potential. Yes. If you find out that the using chemical is very hazardous chemical, then stop the usage of it and replace that medication with the no hazardous or the less hazardous medication. So by stopping the use of that chemical, we are avoiding the occurrence of the risk. It is one. Second one is risk retention. Risk retention means the risk is retained in the institution where any consequent loss is financed by the company. There are 2 aspects to consider here: risk attention with knowledge and risk attention without knowledge. So risk attention means, so normally activities that we are undertaking. So the with knowledge and without knowledge means, so if we have a knowledge regarding the risk, that means how we can remove the risk and what are the activities we can take and what kind of risk is this. So if we are identified or if we have that knowledge, then the availability of the risk, the retainment of the risk could be decreased when we are compared to without knowledge. If we are not aware about the particular risk or the hazardous material, then we are not know how to stop it or how to remove that hazardous activity. So if we are not knowledgeable enough, then there is a higher chances of retainment of that risk. So this is another controlling measure. So risk retention means we are having a proper idea of the risk, which is helpful to remove the risk activity. Risk transfer refers to the legal assignment of the cost of certain potential losses from one party to another party. Example is insurance. Yes, so risk transferring, it is a kind of legal assignment. So insurance means we all know. So we are having a health insurance and the vehicle insurance. Insurance means, so for a health insurance, we are paying some kind of money, and if we got any injury or if we have any health issues, for our purpose, we can get that money. So it is risk transfer. So we are ready. It is also a kind of controlling the risk, financial risk. So think about if a person is not having any insurance and at the later part of their life, they developed a very serious illness and also they are a run out of money. In that situation, they may suffer to cure their diseases. But in case of insurance, in that stage, they can use their amount for the health activities, for their treatment options. So it is risk transfer. In that manner, we are controlling the extent of the risk, extent of the damage caused to that particular individual body. Risk reductions, they are the systematically reduced through the control measures according to the hierarchy of risk control. So there are some measures available which we are used for each and every risky activities in order to reduce. We are not eliminating the risk, we are reducing. So all these control measures like avoidance, reduction, transfer, and the retention, we are not completely eliminating the damage caused by the risk, but we are controlling. We are controlling to some extent, or we can, once the risk occurred, we are controlling or we are minimizing, and also in also we are controlling the occurrence of the risk with the help of any of these measures. So this is regarding the controlling the risk. So this is about the risk assessment. You all need to know. Are you all clear about the risk assessment? If you have any doubts, you can ask now.
Clear, Miss.
Okay. Now we'll move to the next part. Can you all see my screen? Is it visible to you?
Yes, Miss.
Okay. So nursing care plan, as I told at the beginning of the session, when we are talking about the care provided to the patients, the nursing, the management that is followed by the nurses are the most effective one, because the nursing management or the nursing care going to involve all kind of management like medical management, giving medication management, and providing psychological support, providing emotional support, and also it is not only providing the care and management to the patient. Apart from patient, they are involving their family members as well. Family members, friends, the closed one to the patient also we are involving into the caring measures. So that's why I'm telling the caring, the planning measures that are available among the health and social care sector. The nursing one is the most important one and most effective one, because it is focusing only the patient. So the nursing care plan or the nursing management in other, it is following or it is working on the patient-centered way of care or the patient-centered. So you all know what is person-centered or the patient-centered. So this nursing management or the nursing care plan is working according to the concept of patient-centered care. When you're talking about the medical, like medical management means the management provided by the doctors, like surgery and all those things, they are just coming and they are taking a history and seeing you and providing, okay, these are the medications. They are not focusing all the health of the patient body. They are mainly focused symptoms and signs and the disease. What is the patient disease? And they are providing the management to remove that particular disease condition. Wait. to the particular disease condition. But here when we talk about the nurses, apart from disease, they are seeing the patient's emotions, patient's social, person religious wise, all the things they are including. So that's why this nursing care plan is important. And also, if you are going to work, so some of you are following a caregiving course. So in addition to the OTHM level, you are following some caregiving course. The caregiving course, you have studied these things. The care plan, the care that we are providing to the patient is focusing the patient as a whole, not only the patient's physical symptoms. We are focusing all the patients. So caregiving or the caregivers are a part of the nurses. So normally for the caregiving or the caregivers, they are trained by a professional nursing officers. So most of we are, as a nursing officers, we are having a broad level of responsibilities. So among them, some of the responsibilities are carried out by the caregivers, but the management that the caregivers also following the same management, because they are especially trained by the nurses office. So as a you also, when you are going to work in a health and social care sectors, so as although whether you are a nursing officer or the caregivers or not, any of you are going to work in a health and social care, you need to be focused on this. So don't think that it is a nursing care plan. You can focus as a patient care plan. So here we are having some structured way of gathering the information and how you are going to implement. So some of them are specified to the nurses, that means the nursing, but other than that, all the caring management that are providing by through this plan is only focusing on the patient care. These are the learning objectives. At the end of the session, you will be able to define what is this nursing care plan means and why this nursing care plan is important, and the characteristics of the nursing care plan, advantages, and what are the major elements present in the nursing care plan. So first, so it's just for your reference, so it's just for your knowledge, no need to memorize. So normally when we talk about the nurses, we are having one organization, international organization. Like doctors, we are also having an international organization. Each and every nurses who are working in all over the world, they are confined, or they are accept to work under this organization. It is NANDA, North American Nursing Diagnosis Association. So all the activities that we are carried out are standardized by this NANDA. Simply we are telling it as NANDA. The detailed term is North American Nursing Diagnosis Association. So this NANDA, it proposed one definition for this nursing care plan is, it is a kind of clinical judgment made about the individual, family or community, which in response to the health problems and the life responses. If any individual or if any family members, a community, if they are facing any health problems. So this, with the help of this NANDA, with the help of this nursing care plan, we are providing some clinical judgments. It is one definition provided by this NANDA. Another one is American Nurses Association. They also provided another definition. So these two definitions are the most aggregated one. The standardized one we are telling for the term nursing care plan. So these nurses associations, they are telling it is a kind of critical thinking process that every professional nurse used to apply the best available evidence to caregiving and promoting the human functions and responses to health and illness. So both these terms, the basic concept is they are focusing on the whole health of the patient body, and in addition to the patient, in addition to the individual, they are focusing the community and family members, and they are having some critical thinking and clinical judgment in order to providing a good care to promote the functions of the body as well as in order to enhance the quality of life. So that is the basic concept. of this nursing care plan provided by these two councils or the associations. No need to memorize this, but you need to know, for your knowledge, you need to know what is this nursing care plan means. And why we are telling this nursing care plan is important. In other words, we can tell it as nursing process or the nursing management, because it is also having some sequential step. By step, we are doing each and every part. So that's why we are telling as nursing process. So why this nursing care plan is important? Because the primary purpose of the nursing care plan is the documentation. So with the documentation, we can help to have the continuity of the informations, and also we can provide the continued care. So here this is we are telling it as a nursing care plan. Normally, each and every nursing officer, after they provided any care to the patients, they are requested to write a care plan. So this is a structure of the care plan. It is in a chart form. So above the chart, they are writing the patient name, age of the patient, gender or sex, and BHT number. BHT number means we are having a separate records, bed head ticket, so number of that BHT, and the ward number where the patient is admitted. And this chart, it is
Can't hear you, miss.
so this is the structure of the structure of the care plan that we are writing. In this chart, there are totally 6 columns are there. Date and time, assessment, nursing diagnosis, planning, implementation, and evaluation. So date and time, normally we are putting the date and time at which time we did the care to the patient. We are writing. Under the assessment, we are writing the informations of the patient. So for the assessment, for the nursing assessment, we are having a separate guidelines. There are some contents present in the guidelines. With the help of these guidelines, we are gathering much information from the patient. That means by answering each and every questions in that guideline, we can get informations about the patient. So among those informations, if we encounter any abnormal informations, or if we think these are the important one, we are writing in this assessment. So we will see how we are going to collect the assessment from the patient as a nursing assessment. The nursing diagnosis means, so the nursing diagnosis it is a normally we are having medical diagnosis and nursing diagnosis. Medical diagnosis means the disease condition. Once you went for the hospital, then the physician, the doctor, he will check your body and he will tell, okay, you are having a fever, or you are having a diabetes mellitus, you are having a high blood pressure, or you are having any lump inside your uh, abdomen. Like that they are telling. So those disease condition we are telling it as a medical diagnosis. But nursing diagnosis is little bit different. In the nursing diagnosis, we are identifying the patient's problems like signs and symptoms. Sometimes the patient may feel pain, or the patient may have anxiety, or the patient is can't mobilize, can't move. For each and every points, or for the each and every symptoms, we are having a standardized guidelines. With the guideline only we are writing the nursing diagnosis. So with that means the nursing diagnosis simply it will helps to express what are the problems. So what is the problem of the patient, why that problems happens, and as a nursing officer how you identified it. For example, the patient is telling, I am having a severe pain in my hand. So we are writing, okay, pain. The pain is occur due to the injury. So after the injury, sometimes after the surgery, the patient may have pain. So pain related to, that means the pain caused due to the surgery. So how I know as a nursing officer, how I know, because the patient stated me, or the patient told me that I am having a pain. The patient verbalized. So there is a way of writing a nursing captain. So these are the three components included in the nursing diagnosis. So in the nursing diagnosis, we are not mainly focusing on the disease, physical disease. So pain is okay, but pain is a physical condition. But we are normally thinking about the patient's coping level. Coping level means how the patient is, how the patient facing the disease condition, whether they are sensitive or not. All the problems we are including in the nursing diagnosis. That's why we are telling that the nursing care plan is very much accurate, or it is very effective when caring the patient, because under the medical diagnosis we are just focusing on the physical condition of the body and we are providing the treatment to that. But in the nursing diagnosis, as I already told you, that we are checking whether the patient is emotionally supportive, or whether the patient is having depression, all those things coming under the psychological. And we are checking whether the patient is lonely, or how about the patient communication pattern. All the things we are checking. It is coming under the social level and the spiritual levels. All the things we are including. And planning means, yes, we are planning. That means as a normal procedure, after the assessment, we need to analyze this. Analyze, and we are having some solutions. Those solutions, we are writing it as a planning. The solutions or the ideas and the suggestions for controlling that problem, we are telling it as a planning. So once we planned, we are going to implement that. So implementation means the things that we are going to actions. Our actions, we are telling it as a implementation. And evaluation means, yes, it is a kind of reviewing. So after all your actions, how the patient is feeling now. So for example, here, as I already told you, I encountered the patient is having a pain after the surgery. So I am planning. So now I am planning to give the paracetamol, that is normal Panadol, to the patient. So I am planning that to give the Panadol. Then after I giving, so in the implementation, I am writing that paracetamol was given to the patient. So after 30 minutes or 15 minutes, again I am coming to the patient side and asking, how about your pain, whether it is reduced or not. So the patient may tell, oh yes, my pain was reduced when compared to before. Or sometimes patient may tell that no, still I am having severe pain. So this is my evaluation. So under the evaluation, I will write that the patient tells the pain level was reduced. So this is how we are writing for each and every condition we are writing, and every nursing officer, they are maintaining this chart. So So the use of this nursing care plan is, so think about normally in the hospital setup, we are working as a shift. That means from 7 to 12, one nurse, she will do one shift. Then 1 to 7, another nurse. So think about the situation. If there is no any writing this chart or there is care plan. So 7 to 12, one nursing officer, she did all the care to think about a patient complaining the pain. So for her, for that patient, she did all the management. Like sometimes uh, for if even in our home setups, if we have any pain, we are applying some hot compressions, or we can elevating our hands, we are changing our position. So those things also will help to reduce our pain. So morning shift nurse, she did all the things for reducing the pain, but she didn't provide any Panadol to the patient. So again, I am the one who is going for the second shift, and I don't know what are the things that she did. So there is no any written document also available regarding the patient problem. So when if the patient starts to complain regarding the pain to me again, I am also going to do the same things, because under the planning, we are having some format of giving the care to the patient. We are not giving medications directly. So we are having some step by step of providing the care to the patient. So in that manner, I am also again going to give from the start as she did. But now the patient need is the medication, because already she did all that management but no any improvement. So the patient now needs the medication. So but there are, if there are no any documents, I don't know what she did. So that's why I also did the same thing. So here there is no effective patient care. Patient pain didn't resolve. Patient starts to feel pain, the pain become worsen. So there is no any proper care management for the patient side. We didn't focus on the patient care. There is no any patient concern. The time the time wastage of time, wastage of resources, wastage of energy of the nursing officer. So all the wastage only happens. But think about the situation. There is a practice of writing this care plan. So the morning shift nurse, once she finish her routine care, now she is going to write what are the problems he identified in a patient, what she planned and what she did, and what are the statement provided by the patient. So she didn't provide the medication. So when I'm going, so I will go through the care plan that she provided to me. Then okay, I can identify, so she did all the management, but she didn't provide the Panadol to the patient. So now the patient needs the Panadol. Then without wastage of any energy and time, I can take a Panadol, two Panadol and giving to the patient. Then after, when I'm asking patient, yes, now my pain level reduced. So this is very, very effective. So we care about the patient management and we care about the patient problem more. So that is the major use of writing this care plan. So this is the most important use of writing the care plan. So that is the first point. Primary purpose is documentation and record keeping to facilitate the information flow that support the continuity of the care. And also it helps to provide continue and safe and high quality of care to the patients. And yes, it is specific to the nursing profession, but that means we can use it in a caregiving profession as well. And it is a framework for critical thinking. Yes, with that we can identify some critical problem solving solutions. And it is a scientific method for problem solving, and with the help of this nursing care plan we can identify what is the patient health status and what are the problems the patient is having now, and how we can provide the care in order to help the patient to overcome for this. So that's why we are telling that the nursing care plan is most important one when we are talking about the health and social care sector. Then we'll see the characteristics of this nursing care plan. What are the characteristics means? Yes, it is an organized and structured practical guide. It is a framework. And the problem solving is a client focus. That means patient centered way of working. And it is a systematic one. Yes, this nursing care plan having a sequential order or the steps. And goal oriented means outcome criteria. Outcome criteria means they are mainly focusing on the outcome of the patient's body, whether the patient improved or not, whether the patient condition become worsens or they are mainly focusing on the patient's health status outcome. And dynamic, yes, it is not the constant one. With the changes in the patient body or the health status, the it is also going to change. Why? Because if the when sometimes the patient may have pain at the first day of hospitalization, the pain is 10, but after the management in the third or fourth day it reduced to 4. So there is no need to maintain the same management or no need to provide the same management that you provided at the first day, because the pain level now reduced. So now we need to provide the management according to the level 4. So that's why it is dynamic. The dynamic, it is always changing and flexible. And also it is utilizing the critical thinking process, and it is a universal standard. Yes, it could be applicable to any healthcare settings, not only in Sri Lanka. You can you can apply to any countries all over the world, and both the private, public, volunteer sectors, you can follow this method. So that is the characteristic that are the characteristics of this nursing care plan. And what are the benefits that we can gain by maintaining or by writing this nursing care plan means?
Did you share something? We can't see anything.
You can't see. Oh.
It's black, I think. It's for me, the done.
Balam balam. Is it visible now?
Yes, miss.
Okay. Now okay, no?
Yes, cancel.
Okay. Benefits or advantages of nursing care plan is yes, it is providing a systematic method for planning and providing the patient care. We can with the care plan we are having some systematic way of providing patient care. We can plan the patient care and we can provide it in a systematic manner. And also it enhances the nursing efficacy. Nursing efficacy means because most of the times the nurses are the people who are providing care management to the patient. So with the help of this nursing care plan, as an example, I told you that it increases the efficiency of the nursing care management to the patient. And also it facilitates the efficient documentation of the care. Yes, with the care plan we can have an effective and efficient patient care documentation. And the other most important one, with the nursing care plan we can identify, or it will helps to emphasize the patient's need. What is the patient most important need now? What are the care that we need to provide for the patients immediately? So those important needs and important patients care we can emphasize with the help of this nursing care plan. And also when we talk about the healthcare provider, so by having this nursing care plan, by not only nursing care plan, you can use it is as a simple care plan for the patient. So with this patient care plan structure, we can work, the healthcare providers, they can work freely. That means there is no any stress. So if we have, because it is a kind of written document. So with the written document, we can go through the care management at any time if we have it as an evidence. So we can work it in a stress-free manner, in a stress-free environment, and we can work independently. There is no need of depend on other co-workers as well. And also it increases the quality by using the deliberate actions. That means it increases the quality of the nurses work as well as the quality of patients who are admitted to the ward setup. So these are the main advantages we can gain by writing this nursing, by having a practice of writing this care plan method. So okay, I'll stop up to this now, because if I elaborate the nursing process, then you will be confused. Okay. So far, if you have any doubts, you can ask now. And don't think about it is as a nursing care plan. It's just a care plan, because we are normally telling for the differentiation in the medical, in the health field, we are having that nursing management and the medical management for the differentiation purpose. But the nursing management is just a patient care structured way. It is a kind of patient care management. So you can keep in mind in like that, patient care plan or the patient care management. For the differentiation purpose, we are using it as a nursing management. So if you have any doubt regarding today's session, you can ask. And I hope that you all uploaded your first assignment, because your deadline finished on 21st and the second assignment will be on 28th, coming Wednesday. So you have the portal for uploading the second assignment as well. If you are not having any doubts, then we can wind up the session.
Okay, miss.
So you all are clear? No any doubts?
Clear, ma'am.
Okay, thank you. So if you have any doubts, you can ask in the next class as well. I uploaded two presentations, the PDF to the MS Team as well. You can download it. Okay, so see you all in the next week. Bye bye.
Bye bye, ma'am. See you.
Thank you,
Thank you,
ma'am.
miss.
Thank you, ma'am.